Dr. Padmaja to Dr. Anjali, and then to Dr. Aniruddha Malpani. I have the privilege today to introduce our chairpersons, who are extremely eminent and renowned people. Dr. Indira Hinduja has many firsts to her credit. India's first test tube baby, first gift baby, first oocyte donation baby, her keen interest in infertility and reproductive biology research has led to various projects in the fields of implantation, male infertility, and stem cells. She is hopeful that in future the stem cell research would help in curing infertility and providing women to have their own biological children. She has been awarded the Padma Shri, Dhanvantri, among many such awards. You remain a constant source of inspiration for all the students and for all the faculty here, madam. We welcome you to KEM. Dr. Jatin Shah is another renowned infertility specialist who has pioneered setting up of IVF clinics across India, and he has done more than 20,000 successful IVFs. A much sought after keynote speaker, he has several publications and presentations to his credit. May I now request our chairpersons to kindly introduce our speakers, Dr. Aniruddha and Dr. Anjali Malpani.
Before I start introduction for these our good eminent speakers, I would want to clarify one thing. There is always a big confusion and criticism about the first, I said first IVF center. Leave aside that, the one which we did in this institute is known as India's first scientifically documented test tube baby. So, the word scientifically documented is being clarified by ICMR to erase the confusion between the first, which was being called before in Calcutta, and this. Why? Because it's each and every step of this procedure is being recorded and documented and published from time to time. Therefore, I would like to clarify that ours is the first scientifically documented India's testing. Now let's come to the subject. Gathered here to initiate IVF Centre in KEM Hospital. There are several reasons why our center closed down, but I think this is not the platform to say. I'm very happy to start one IVF center, and I'm happy that credit goes to Mr. and Mrs. Malpani, which they really deserve. These were the very two prominent, clever, sincere, and hardworking students of Congress. Now let's talk about first Anjali. Anjali Malpani is the pioneer in the field of IVF and reproductive medicine and runs one of the India's first private IVF clinic, which she has with her husband, Dr. Aniruddha Malpani, and she has started from all over the world, from more than 100 countries. And around 17,000 babies have been born as a result of her treatment. She is Professor and Emeritus at the King Edward Memorial Hospital, and she has many firsts to her credit. She started with India's first sperm bank in 1990. supported by the infertility couples in 1997. First pregnancy after PGT, that is pre-implantation genetic diagnosis in India, and she recently authored the Thrive, Sight, and Lubanis, the unfolded stories of IVF. We discuss the memorial and the social aspects of the infertility. And she's recently authored this book, it's been published. Congrats. Anyway, let's have now Anjali, and she will tell you about it.
Hello. Hi, guys. It's so much of nostalgia, because I've spent the 8.5 best years of my life in this institute. And I'm really envious of all you UGs and PGs, and I wish I could relive those days because they were really the best days. We didn't have any NEET, we didn't have PG NEET. We did well in 12th, we got into GS, you did well in Dynac, you got into PG Dynac, as easy as that. And at that time, I remember when I was in my UG days, I was always in awe of one power couple of KEM Hospital, and that was Dr. Aniruddha and Anjali Malpani. They were bosses even then, and they are bosses even today. And I remember the fantastic times we had. I don't know how many of you are aware, but Aniruddha was one of the best orators that we have ever produced from this institute. I remember all the vociferous debates he used to have in the maternal mortality and perinatal mortality meetings. And I'm really proud of all their achievements as a couple in the field of IVF. Of course, together they run a state-of-the-art clinic, treated thousands of couples. Many of you would know that Aniruddha has had more than 25 gold medals in his journey, which in itself is a fantastic, amazing record. He's also an excellent angel investor, but besides that, he was the first one to introduce me and all of us medical PGs to the fascination concept of the internet. We didn't know what internet was 20, 25 years ago. He was the first to catch on that this is going to revolutionize the lives not only of medical practitioners, but of patients all over the world. He's a champion of creating patient awareness about IVF, infertility, empowering patients. They need to have information, they need to know which clinic to select, which doctor to go to, and so on. Recently, of course, he has done two very good initiatives. One is the Minds Laboratory at JJ Hospital, which is going to encourage medical creativity, innovation, entrepreneurship. And of course, all of you are aware that he has not only contributed financially, but with his full academics and his entire heart and soul in setting up one of the first and the best IVF units in our very own King Edward Memorial Hospital. So with this and a huge round of applause, I present to you Dr. Aniruddha and Dr. Anjali Malpani. Thank you so much.
Can we have Dr.
Today, I'm greatly honored and privileged to be here with you all to celebrate the 100 years of KEM and St. GS Medical College, which is one of the finest institutions in India and that has shaped some of the finest minds in the world. Standing here on this basketball court today feels surreal. Way back in 1978, I stood exactly on this very spot, not as a doctor, but as a very scared, clueless grand junior who had no clue how to play basketball and had never played before, but yet was drafted into the basketball team 10 minutes before the basketball began. The instructions given were very simple. You are the shooter. Just go, stand in the D, catch the ball and shoot. And that's exactly what I did. And 25 times over. So you can imagine that this scared, scrawny, short girl became a basketball star overnight. It was this single movement marked the beginning of not just a beautiful love story, but a lifelong partnership. Because this was then where a tall, very serious, very studious, and a reserved boy called Aniruddha came over and congratulated me. So this was the beginning of our partnership in marriage, in medicine, and in purpose. Our friendship continued through the years, through our residency. and the staff fondly called us as Amitabh Bachchan and Jaya Bachchan. And it seems and they haven't forgotten even today. Because just recently, when I visited the labor ward, 40 years later, one of the elderly nurses actually recognized us, came running and said, "Oh, look, who's here? This is Amitabh and this is Jaya Bachchan." KEM just was not where we met. This is where we found our calling. When I was a resident in the gynac department, I used to see many infertile patients in a busy OPD. That time, there were no treatments available. And in fact, we used to say, "Oh my God, this person's coming again and again. Oh my God, what do I do with her?" All we would do say, "Oh, okay, come back, go for a holiday, come after 6 months." If it was a male problem, we didn't know. We used to say, "Refer to urology." Sometimes we would do a DNC. And there's nothing much you could do. And these poor women kept on coming back to us. I used to feel sorry for them. And in my lunch break, would actually sit and listen to their heart-rending stories of desperation, isolation, ostracism, and sometimes even suicide. And that's where I decided that I would go ahead and do infertility. But unfortunately, there were no treatments at that point, and there was no training in India. So I decided to go abroad. But the goal was very clear, that I would go abroad and bring back these treatments so that every Indian couple could avail these treatments and make them accessible to all. So that's exactly what we did. Aniruddha and I went to KEM's College and came back and started Malpani Infertility Clinic in 1990. Since then, we have treated patients from all over India, from the remotest villages, and not only India, but also from 100 countries all over the world. And today, we have about 17,000 babies to our credit. I owe a lot to KEM for providing me with an exceptional education and instilling in the virtues that make a good doctor. Here are some lessons that we learned from KEM that I practice even today. KEM taught us grit, the kind of resilience that no textbook can ever impart. I still remember those countless days and nights that I've spent in the labor ward side room, monitoring severe critical patients, most commonly eclamptic patients. I did not eat, I did not sleep for days. Back then, it was exhausting. But today, I know that these moments are the moments that have shaped me into the doctor I am. It was here that we learned an important lesson, that there were no shortcuts in medicine and that patients always came first. KEM taught us empathy. This, I think, is the single most important virtue that every doctor should have. Compassion, care is very, very important to become a good doctor. Very often, we are so busy, running around, seeing patients, either in your clinical rooms or operating on them. And we take so much pride in our academic skills, in our clinical skills, that we forget this basic skill of compassion and care. But remember that patients don't care how much you know until they know how much you care. I'll never forget Dr. Palnetkar from Cooper Hospital, who was my boss, and who would take me on my rounds in the postpartum ward, where we would sit and chat to the patients who had normal deliveries. He would teach us to ask them, "How do you breastfeed?" We would just listen to them for hours together. Everyone laughed at us and said, "Oh, they're spending so much time." But the truth is that this is what is important in future. I learned an important truth, that medicine is about people and not just diseases. This lesson has stayed with me even today and has become the cornerstone of my infertility practice. I yet spend hours listening to patients, to their stories of ostracism, of sadness, and of pain. You don't always need a prescription. You don't always need a medical treatment. All you have to do is give them a listening ear and a helping hand and guide them through their problems. In fact, I've recently written a book called Tries, Sighs and Lullabies, The Untold Stories of Infertility, which talks about the emotional coaster and the troubles that these infertile couples go through. One of my favorite quotes is also by Sir William Osler, the great physician. A good physician treats the But the most important thing KEM taught us was clinical excellence. Clinical excellence is the ability of the healthcare provider to consistently deliver the highest quality of care to the patients in order to have the best possible outcomes. Clinical excellence is different from excellence because it requires the doctor not only to have knowledge and skills to connect this knowledge to the clinical skills, but also excellent communication and interpersonal skills to get a good doctor-patient relationship. It also requires the doctor to have empathy, compassion, and care. Clinical excellence involves dedication to the highest standards of practice, a commitment to continuous improvement, and a willingness to go beyond the patient's need. Clinical excellence ensures that the patient receives the best treatment possible to get the best possible outcome. And it also helps the health provider to lead a fulfilled and satisfied life. At this point, we have the privilege of working under legendary professors like Dr. Manu Kothari, Dr. Ravi Bapat, and Dr. Sunil Pandya. They not only taught us clinical excellence, but also taught us the science and art of medicine. Their teachings, along with the sheer volume of patients and the variety of cases we saw at KEM, prepared us to excel anywhere in the world. Let me share you with my own story at Johns Hopkins way back in 1982. I was doing an externship at the Johns Hopkins Hospital, a world-class hospital in the unit of pediatric cardiology, which was supposed to be the best in treating cardiac complex diseases. The norm in that unit was that every resident and every intern would see their own patients, investigate them, and give a diagnosis. So one Friday morning during our grand rounds, the boss, Dr. Kidman, who was one of the best in the world and very renowned, asked us our diagnosis. Most residents did not know it or were blank. Some of them said, oh, we are waiting for the results of the echocardiogram, which was one of the new machines at that time. Then it was my turn. I was just 22 years old. I was the junior most person out there. And it was my first few days out there, in fact. And I was completely floored by the new machines, the new hospital, the hospital look, the doctors, and everything was so scary. But though I was scared, because I had auscultated thousands of murmurs in KEM Hospital, I confidently gave my diagnosis. And everybody got silent. Everybody just stared at me as though, I was an alien or I just felt I was wrong. The next day, the boss called me inside the room and said, the echocardiogram results have come and your diagnosis is correct. But how in the world did you manage that? I smiled and I said, back there in India, I come from KEM Hospital where I've auscultated hundreds of these. So these are second nature. So that's the kind of clinical foundation that KEM prepares you for, to hold your ground and to stand tall in any setting, anywhere in the world. So please, do not spend time just reading textbooks, sitting at home, mugging up, cramming for your exams. You have the patients right out here. The sheer volumes, the variety of cases that KEM Hospital gets is not available in most hospitals anywhere in the world. And we cannot compare ourselves even to Harvard or Hopkins in that matter. So remember that patients are your best teachers. As you step into your journeys, you may realize that money, success, fame have very little meaning, and it does not give you happiness. I would like to share a few secrets that will give you a happy, fulfilling, and meaningful life. Number one, find your purpose in life. Discover what drives you. What is that one thing that makes you get up in the mornings? Find your raison d'etre. Find your ikigai. Ikigai is a Japanese concept that unites the joy of life with a sense of purpose. Iki means to live, gai means reason. So that is the raison d'etre, the reason to live. Ikigai helps you to discover your ikigai by exploring the intersection of 4 elements. Passion, what do you like doing? Vocation, what you're good at or your skills. Mission, what does the world need and how can I contribute to this? And profession, what you get paid for. This age-old philosophy offers a structured approach to identifying your purpose and leading a happy, meaningful life. So how do you find your ikigai? It's not very difficult. Sometimes you do things because you're forced to do things. Maybe your parents are doctors, or maybe it's easier to take, let's say, a subject because it's easier to study, or you don't want long hours. But the best thing is to follow your heart. What you need is a little bit of introspection, mindfulness, maybe a little meditation may help. And find what is that one thing that you like, what is that one thing that you're good at, and maybe combine this so that you can have your profession. Number 2, always do the right thing. Just that you do the right thing, the rest doesn't matter. Cold or warm, tired or well rested, despised or honored. This is a famous quote by Marcus Aurelius, the great Stoic philosopher and the Roman emperor. It emphasizes the importance of moral integrity and virtue. It encourages us to do the right thing, even if it costs us everything. Always do the right thing is a fundamental value. That means acting in such a way that you're honest, truthful, and kind. It means doing what is the best for your greater good or for the common good, rather than making decisions that are based on your personal benefit. Doing the right thing is important because it gives you self-respect, self-confidence, and a strong character. And it also has a positive impact on the world. As you start your practice, there may be many occasions where you will be tempted to do the wrong thing. Maybe for money, maybe for success, maybe for fame. But just remember, if you're confused or you're not comfortable doing it, again, wait for a moment, introspect and think, are these the values that I have been brought up with? What will people say? Is this the right thing to do? And the answer is right there. Again, as Marcus Aurelius said, if it is not right, do not do it. If it is not true, do not say it. Money and fame may come and go, but your character will define you forever. As Ralph Emerson has said, nothing is at last sacred but the integrity of your own mind. And number 3 is find a way to serve the world. In today's world, we admire people who are rich, successful, and are famous. But true value does not come from being just known. It comes from doing service. Fame fades, but the impact of service endures. And if you look at all the successful people in the world, it may be Mark Zuckerberg, it may be Warren Buffett, in our own countries, the Tatas and Birlas, they all always have done great philanthropic work and have served the community because they know that true happiness lies in giving. As doctors, we have a unique opportunity to serve the world by combining knowledge and compassion. As one of the pioneers in this field of infertility, I have witnessed the evolution of assisted reproductive technology and contributed to its growth in the country. Then a time when fertility was considered as a curse, a stigma. When treatments were in their infancy, I worked tirelessly for 35 years to bring hope to these countless couples. Initially, I went abroad with the aim of getting these treatments and making them accessible. But today, I have a bigger goal, a mission that all infertility patients, I would like to make infertility treatments not just accessible, but affordable to all people. And I'm delighted to share that Dr. Aniruddha and I will be starting a world-class IVF center right here in KEM soon. It will be called the MAA IVF Centre. It will provide cutting-edge infertility treatments to patients from all walks of life, ensuring that even the most economically disadvantaged have access to world-class care. The goal of IVF is not just to help the infertile couples realize their dreams, but also it will be used as a hub for research and innovation, and it will be a training center which will provide hands-on training to clinicians and employers. Through this initiative, we aim to bridge the gap between advanced medical technology and affordable healthcare and establish KEM Hospital as a leading center for infertility center in the public health sector by integrating state-of-the-art technology and compassionate care. So, in conclusion, the MAA IVF Centre is not just a project. It is my heartfelt tribute to KEM Hospital, my way of expressing gratitude, and my hope for the future when no couple is denied the joy of parenthood due to financial reasons, and that every couple who comes out here could dream of having a baby of their own. Thank you.
So, I think one thing we all know, that being a doctor is really not easy. It's actually progressively getting worse day by day. And I think there are multiple reasons for that. Lots of paperwork, you're treated as knights, you think of yourself as being knights who are out to help patients, and effectively you end up being treated as knaves. Lots of us are pawns. It's hard to really get enough credit for the hard work which we do. And this is often what the life of a medical student is. And what's worse is, it really is going to be part of it, because hospitals are high complexity zones. There is just so much opportunity for things to go wrong. And especially in a place like KEM Hospital, when you're so overburdened by work, imagine you've spent 2 sleepless nights, this is the 3rd day in the OPD, you have all these patients, lots of your patients aren't very articulate, they don't know what their problems are, and still you need to be able to sort some of this out. So it is definitely a breeding ground for error. But it doesn't end just when you graduate from medical college. Even when you end up going to practice, it's become a bit like this. This is what is called doctor shopping. It's not like a patient will come to you and say, yes, you know, you're God, you do whatever you like. Doctors will choose, do I go to patient, Doctors don't get to choose anymore. It's patients who decide, will I go to this doctor, that doctor. It's become highly competitive. And this is a big problem, because lots of patients these days will do a Google search. And because they've done a Google search, they obviously think, hey, God, we know everything. And the problem is sometimes you need to remind them that, yes, a Google search is great. We want patients to be well informed and well educated, but that's really not the same as having a medical degree. But today, this is sometimes what the situation for the poor patient is. It's not like the patient enjoys going from one doctor to another doctor, but the patient is completely confused. And often Google is responsible for that, because they go to Dr. A who tells them something, Dr. B tells them something else, and Dr. C ends up telling them something completely different. And trust me, if you think listening to lectures in medical college is boring, once you start practice, you're going to have to listen to so many more lectures from your patient who, because they've been to other doctors or because they've run stuff on a website, they end up thinking that they know a lot more than you. But you know what? medicine is a service profession. You can't afford to lose your temper, and you jolly well need to learn to be patient. But the big problem today is anything which goes wrong in a hospital, whether the oxygen runs out, whether the IV fluids are contaminated, for anything which is completely outside a doctor's control, the first rule is the doctor messed up, have them jailed. And the problem is doctors have become extremely soft targets. And I think this is such a problem because this never used to happen when we were junior doctors. But today you keep on reading about these incidents about doctors being bashed up in spite of all the security measures. And doctors now feel increasingly insecure. And I think sometimes this is true. I think sometimes you don't need more hats. You actually need more heads in order to deal with this problem. So I'm not trying to complain about what's happened. I think the reality is that yes, the present is grim. But I think the good news is there is a lot we can do in order to fix these issues. And this is where we come to the ABCs of being a good doctor. All of you are going to sit for multiple exams, and I'm sure all of you love mnemonics and acronyms. So I first started off with A to Z of being a good doctor. But I thought A to Z was too long. Dr. Sangeeta said you only have 20 minutes. So I said, fine, let me cut it down to just the ABCs of being a good doctor. Where A stands for accountability, B stands for bedside manner, and C stands for continuous learning. So that's easy enough to remember, and I'm going to go through this again. What does accountability mean? And I think sometimes we forget that being a doctor is such a great privilege because you're treated as a respected professional. And the reason you're treated as a respected professional is because you have a fiduciary responsibility to your patient, that it is your patients who come first, irrespective of where your salary comes from. Please learn to take full responsibility for your patients. And remember one thing, patients understand that we are human, that we're not God, but they really appreciate honesty. So please treat your patients as partners. And I actually start off every consultation by telling patients, I'm not a mind reader. Ask me a question, I'll answer it. But if you don't ask me the question, I can't. And I'm not a fortune teller either. I'll do my best, I promise you that. I can control the process, I can't control the outcome. This again is extremely helpful as a professional. This is called the trust equation, which applies across all professions, especially for doctors. Trust stands for trustworthiness, C is your credibility, R is your reliability, I is intimacy, divided by self-orientation. So what does this mean? Credibility means, can the patient trust what you're saying? Now remember, patients will trust you, but they will verify whether what you're saying makes sense or not. And the good news, or using Google, so they will always triangulate and check. Reliability meaning, when you're going to tell them, you're going to give them a phone call, you're going to share the results of the reports, do you actually do that on time or not? Intimacy means, are you in a rush, so rushed that you don't have time to talk to him? Or are you going to sit back and talk to him so that you treat him as a human being? And self-orientation is, does that mean that you're going to care about making money for yourself, or do you care more about him? And I think in order to become a good professional, the one thing which KEM will teach you is grit and discipline. And this is what Dr. Anjali said. If you can manage the workload which KEM throws at you in private practice or even afterwards, you're never going to have to manage difficulty. You need to work hard to earn your patient's trust, but it's worth the hard work. And this, of course, is a simplification. The easy way to be a good doctor is to learn how not to be a bad doctor. What's called the reversal or the inversion rule. And this is sometimes the problem, that doctors start getting arrogant and they think, hey, I'm God's gift to mankind and I know everything to do. B is your bedside manner. And this is something we keep on trying to teach you. Remember, the doctor can be the most powerful medicine for a patient. What's called your therapeutic presence. And the secret of the care of the patient lies in caring for the patient. And the patient can make out, are you more interested in treating the lab report and the CT scan? Are you more interested in treating him? I think this is a really important slide. And I wish I had more time and I could ask you more questions. But this is actually from the 19th century, when doctors didn't have antibiotics, you didn't have IV fluids, you didn't have CT scans, and you still needed to treat your patient. And this is a doctor who spent all night with a sick child, offering his therapeutic presence, his bedside manner, which was so reassuring, not just for the child, but even for the child's parents. But please notice one thing. There was no intensive care unit, there were no ECG monitors, there were no IV drips. It was just the calming presence of a senior doctor which made a difference. And please remember this, just like you are a person, a human being who has feelings, so are your patients. And it's compassion, kindness and empathy which really bridge the gap between all the science which you will learn in KEM Hospital and your humanity. And people will never forget, patients will never forget how you made them feel. And of course, all you guys have a great IQ. If you didn't have a great IQ, you wouldn't get into KEM Hospital. That's taken for granted. What you really need to be working on is your EQ. This, I think we need to remember, is that if you love humanity, you will automatically become a good doctor. That just goes without saying. And this, I think, is the most important thing, because remember, your students, and the most important thing KEM prides itself on is being an educational institute. And you need to keep on learning how to learn and to unlearn and relearn. As a famous professor told us, 50% of what we're going to teach you now is going to be wrong. And the trouble is we don't know what 50%. And if you don't trust me, do me a favor and get an edition of Harrison's Principles of Internal Medicine, which was written 50 years ago, and compare it with the edition today. And you'd be surprised at how much has changed and how many of the procedures which were standard in my time have become completely obsolete. So typically we learn from lectures, we learn from textbooks, we learn from our friends. Today I believe everyone goes to coaching classes and learns from them. But the best source of your wisdom is patience. And nurses are really extremely valuable sources of wisdom because they've seen so many patients over their lifetime. But you know what? The beauty about being a doctor is you never stop learning. And I'm learning all the time. And that really gives me joy. I think the great thing about being a young student today is you can play to your strength. You have a great education. You have a lot of energy. You have a lot of resilience because you've already been through lots of ups and downs to get into KEM. But the one thing which you have, which oldies like me who've become dinosaurs don't have, is the agility and the flexibility. And trust me, India's economy is booming. We're going to do so well. It's become the land of opportunity. Make the most of it is what my request is. So how do you learn? And I think the biggest problem is all we've been taught as students is to learn how to cram, because everyone only cares about exam marks. But really, curiosity is far more important than knowledge. And you've got to replace the fear of the unknown with the joy of being able to learn something new. Because the reality is you can never learn all of medicine. Whatever you learn has a short half-life, especially because things are evolving so rapidly. And I don't think there's anything to be scared about this. And it's perfectly okay to encourage your patients to ask you questions, even if they seem to be stupid questions to you. So how can we get doctors to innovate? And I think if you guys pay attention, you will notice this is not a picture of KEM Hospital. This is a picture of JJ Hospital. And the reason I put that up is sometimes the problem with being in KEM is you get this attitude is, hey, we are the best, we know everything. My request to you is please step out the four walls of this campus. Explore Tata Memorial, explore Wadia Children's, explore JJ Hospital. Each of these hospitals will do things differently, and there is always something to learn from these hospitals, so make the most of it. How do you reinvent medical education? And I think we need to teach you guys that all the knowledge is not locked up in lectures and medical textbooks. And we need to create an entire generation of digitally, technically savvy doctors who come up with innovative solutions, who come up with solutions which are right for India. And that's what our goal is. And we need to remember, it's not the guy who scored the highest in an exam who will do well in life. It's the person who can manage change. And trust me, everything will change every 10 years. And if anything, the rate of change is going to be even faster in the future. And I think this is an important slide. As a doctor, we're so focused on treating our patients one-on-one, which I think is great. Because when a patient is ill, what the patient needs is time, compassion, the fact that you're willing to speak to them and solve their problem at one time. Doctors shouldn't be cowboys and shouldn't be experimenting on their patients. But you know, the great thing about engineers is they don't just try to solve one problem at a time. They try to think of, okay, who are the other 99 other patients who have a similar problem, and what can we do in order to come up with a solution to solve them all at a time. And I went to Stanford. They have this great biodesign program, which actually is transdisciplinary. It helps engineers to think like doctors and doctors to think like engineers. But one thing I'll tell you, fortunately there's no engineer here, but it's much easier for doctors to think like engineers because doctors are much smarter than engineers. And we work, yeah, maybe I'm biased, but the reality is any of you guys could easily have got into IIT if that's what you wanted to do. So I don't think really it's a problem of intelligence. It's just the willingness to learn new skills. And this is the reason we started Medical Innovation, Creativity and Entrepreneurship Laboratory. We started it in JJ Hospital. We've been running it for 6 years. It's extremely successful. We've been trying to start one in KEM Hospital because I think KEM Hospital students are brighter than JJ Hospital students. But I didn't say that publicly at least. But the point is every medical college needs an innovation lab because professors have seen so many clinical problems, but they don't know how they can use technology in order to solve the problems. And this is one of the reasons we've run this program. Just to give you another example, as Dr. Anjali said, we're both IVF specialists, but we see so many patients with polycystic ovarian disease or PCO, and we thought, what can we do in order to make the treatment of PCO kinder, safer, much easier, so that instead of doing a laparoscopy, we can actually treat these patients with vaginal ultrasound, which is a short procedure which any gynecologist can do for themselves. It cuts costs, cuts risks, cuts time, and in fact, we got a patent along with IIT. And this is what we really need to do, create partnerships with other institutions so they can learn from us and we can learn from them. I'm now coming to the end of my presentation. If these are the messages I want you to take across. If you want to be a successful medical student, please create your own website. And as Dr. Jatin said, I've been saying this for the last 25 years and it's become even more important because your website will allow you to teach what you have learned. And it's important to teach other students. It's important to teach your patients. But you know what? It's really important to teach your professors because your professors they think they know it all. But often a lot of what they know is no longer true or accurate or reliable simply because things changes. And that's why you need to learn how to learn. I remember, as Dr. Anjali said, 40 years ago, when we went to Hopkins, we always felt as third-class citizens coming from a poor country because the laboratories were so much better, their MRI scans were so much better. But the beauty is thanks to KEM Hospital and the municipal corporation, we're now investing in making this a state-of-the-art hospital. Your libraries are brilliant, you have access, and for example, you can get access to any textbook, not even medical textbook, any engineering textbook, physics textbook, anything you want on ANA's archive. These are all full text. We've written a lot of books. Again, a lot of these books were written 20 years ago because when we started practice, we said it's not so much about our doing well. How can we share what we've learned with junior doctors and other doctors? So all these books are available free on this website called The Best Medical Care, where we're really trying to help patients to take better care of themselves. And honestly, I think in this day and age, any doctor who can't use generative AI tools like ChatGPT or Perplexity is going to get left behind very, very quickly. And the beauty about ChatGPT is it's your personal tutor all the time. So there's never any reason to say, you know what, I'm a neurologist and I don't understand cardiology, or hey, I'm a diabetic specialist and I don't understand this. Patients are not interested in being treated as diseases or silos or specialties. Your job as a doctor is to treat the entire patient. And thanks to all these tools, you can use them. And whether you use them or not, trust me, your patients will and your juniors will. These are 3 simple things you can do. Please buy a laptop. And I've given a lot of lectures to medical students and to a lot of MBA students. But you go to an MBA class and they all have their laptops in front of them because they're taking notes digitally, they're recording the lecture. But when you give a lecture to medical colleges, they're still using pen and paper in order to take down notes. And I think I cannot believe why we would do that anymore. Because the moment you do it digitally, not only do you remember, you can share with the rest of the world. You can share with your friends. You can translate into local languages. Trust me, you guys are fortunate you're in KEM Hospital. But what about all the medical students who are graduating from Bihar medical colleges and UP medical colleges? They don't have access to your medical professors, and I think you have an ethical responsibility to help them to become better doctors too. As I said, create your website and become a self-directed lifelong learner. Don't expect to be taught because the reality is no one can teach you. you're responsible for learning for yourself. The best thing to do is to educate your patients. And your patients are great unpaid research assistants. They will have so much at stake because it's ultimately their disease. They'll be happy to teach you. And I think the one thing you can recognize as a doctor is the joy of practicing medicine. Treat all your patients as VIPs. They are VIPs. They've trusted you with their life. Please respect that and take good care of them. And one thing I will say, when a patient thanks you, remember they're not thanking your seat or because you happen to be a member of parliament or because you are an IS officer. They are thanking you as a person, as an individual, because they know that you helped them get better. And this is invaluable. Trust me, no one else in the world gets this personal connection. Please learn to make the most of it. There's lots of positive feedback which you get daily. It's such an opportunity. And I tell everyone, it's not like a doctor's financial income is the best, but your emotional income is unmatchable because you actually get heartfelt thanks from patients and their relatives every single day. And the best doctors are those who really enjoy what they do. And this is what I call the T-shaped model of life. Of course, you need to go deep, and I know a lot about IVF, but you also need to extend what you've learned into other fields. And that's why I enjoy being an angel investor, because medicine is just a small part of the real world. There's so much to learn about technology, financial technology, quick commerce, AI. And once you start putting money where your mouth is, you're forced to learn from these entrepreneurs, all of whom are very clever. And that's one of the reasons why we started this MAA IVF Centre of Excellence. We started the construction. I think hopefully it will be functional in a few months. And not only will then be able to take good care of patients, we'll be able to teach students how to do this. Finally, I'm always grateful to KEM Hospital because institutions make people, but remember, people make institutions. While you're in this institution, there is so much you can give back. And even when you graduate, you will continue to be able to give back. Please make the most of it. And that's my last slide. I think even if you forget everything else I told you, but you just remember this, that your responsibility as a doctor is to put patients first. You will be a happy doctor and your patients will be happy as well. Thank you.
Thank you so much. That was an awesome talk by the most dynamic couple, KEM Zone, Amitabh and Jaya. Can we have a big round of applause for them? The pursuit of medical knowledge is a journey, not a destination. And it is very important to understand that compassion is a cornerstone of care. Yes, empathy is the bridge that connects us, and that is what has been so very lucidly told by both our speakers today. May I request our chairpersons to kindly felicitate our speakers, Dr. Anjali Malpani and Dr. Aniruddha Malpani, with a small token of appreciation from these twin institutes.